Welcome to another episode of Senior Sessions. I am your host, Dr. Denbo Burke. While aging brings wisdom and great experiences, it may also bring health problems which at times may require surgical interventions. Oftentimes, there is a general fear of surgery, the process of going under anesthesia, and just the thought of not having control over one's body. This can result then in deferral of surgical interventions, leading to adverse health outcomes. So today, we have invited Dr. Neville Burke, who is a specialist in the field of anesthesia and intensive care, to help shed some light on anesthesia in elderly individuals, with the hope that we may have a more positive outlook on surgery in the elderly population. Thank you for joining on this episode, Dr. Neville Burke.
Thank you for having me, Dr. Denbo Burke.
So what really is anesthesia?
So, to put things simply, anesthesia is a field of medicine that specializes on different types of interventions that make surgical procedures possible. There are two broad categories or types of anesthesia. One is general anesthesia, where an individual is given different types of medications that puts the entire body to sleep. And the other is regional anesthesia, where just a single part or region of the body is put to sleep.
Okay. So relative to the general population, how common is surgery in elderly individuals?
Individuals above the age of 65 account for about 35% of all surgical operations that are done.
Wow, that is quite significant. That is like 1 in every 3 patients.
Indeed. In fact, the most common operations that they do are surgeries on the hip, so repairs of hip fractures or hip replacements, cataract surgeries, sometimes also frequently seen would be operations on the heart or coronary artery bypass grafting to revascularize the heart, and they also do a lot of spinal operations.
Okay, so is being old a risk factor for an adverse surgical outcome?
I would say that the incidence of perioperative complications, which are things that can go wrong around the time of surgery, is greater in the older population than it is in the younger population.
Okay, fair enough.
Yeah, essentially, though this may be related to age, research has shown that there's another concept that is more commonly linked to these adverse outcomes than age itself. This is something known as frailty.
So what are some common features of frailty?
So some common features of frailty include things like slowness, weakness, exhaustion, weight loss, and decreased physical activity. Frailty essentially is a state of decreased physiologic reserve. So as you know, normally with aging, the body's general functions or the body's organic functions tend to slowly decrease over time.
Right.
Which means that as you get a little older, you will be able to handle certain types of stressors less well than you may be able to in a younger age. Frailty is more of an advanced or accelerated form of this decreased physiologic function, or you can consider it an excessive form of deconditioning of the body, which means that in frailty, when you encounter any kind of stressful event, such as an infection or trauma or surgery itself, the body is much less able to recover or come back to a state of normal function.
Okay, so the ability to bounce back to the normal state is a bit compromised.
Yes, that's a very good way of putting it.
Okay, so tell us what are some adverse effects of having a decreased physiological reserve in an elderly patient going for surgery?
So having a decreased physiologic reserve would mean that essentially one is less able to recover quickly from the operation, and may mean that you're at more risk of suffering some of the complications that can occur with surgery. whether those be related to decreases in function of the lungs or pulmonary complications, or decrease in function of the heart, or cardiac complications, even including things like myocardial infarctions or heart attacks, and sometimes as well acute kidney injury. Particularly in the elderly population, there are a group of complications that occur in the brain itself, known as post-operative delirium and post-operative cognitive dysfunction, or POCD.
Okay.
Yeah.
Wow, so that is quite interesting, because many times elderly patients and just the general population would go for surgeries, but we don't stop to think about the effect that it has on our brain function. So tell us a little bit about post-operative delirium and cognitive dysfunction.
Well, post-operative delirium, as the name suggests, is delirium or an acute change in brain function that happens after surgery.
Okay.
It usually takes about a day, so it would come on sometime between 24 and 72 hours after an operation. And is somewhat common in about 10% of elderly patients that have surgery. There will be some amount of post-operative delirium. However, this number can go as high as 65% in certain types of operations.
Oh, wow, like complex surgeries?
Yeah, usually like very complex operations like cardiac surgery.
Okay.
And also in like emergency surgeries where usually the individual is quite unwell going into the operation.
Okay.
Right? The most common feature of post-op delirium is something known as inattention, which simply means that you have a hard time paying attention or staying focused on things that are happening around you. But it can also have psychomotor features, which can vary from or across a spectrum of being hypoactive, where one is very inactive and not really doing anything, just quiet and maybe poorly responsive to one's environment, or hyperactive, where an individual may be doing an incredible amount of things and be very, very active and sometimes even aggressive and maybe combative with individuals around them.
Okay, okay. And
the post-operative cognitive dysfunction, or POCD, usually lasts for a much longer period of time than post-op delirium. Post-op delirium is thought to last maybe at most a couple weeks and then hopefully will settle or go away. Even though it lasts for a short time, there are some other long-lasting effects that can result in terms of you may become more unwell from other problems. But the POCD usually lasts for a longer time, so weeks to months. It may sometimes be quite subtle and just appear as some maybe just very simple memory deficits, so you may just maybe not remember everything you used to before. You remember half of someone's phone number and can't recall the remaining digits. Or it can be very severe, so much so that one's ability to function independently can be compromised.
okay. So thanks for giving some more insight on that. So in closing, Dr. Burke, what would be some advice you would give an elderly patient to help decrease their anesthetic risk?
Well, I would say to any person, and particularly to elderly patients who are presenting for surgery, that first of all, you should not be worried. Though you may feel a bit apprehensive or nervous about doing some kind of operation, if you've consulted with your surgeons and they think that it is in your best interest to do so, then maybe you should at least give it some good consideration. If you do decide to do the operation, then what would be best is to ensure that you also consult with a physician anesthetist before the surgical operation. Preferably one who is well versed in providing anesthesia for older adults, so that this person would have the necessary knowledge required to take care of you appropriately. Once you consult with your anesthetist, that individual will ensure that all of your chronic illnesses or any other issues that you may have are dealt with appropriately so that you can be fully optimized before the surgical operation. Just the act of ensuring that your physiology is well optimized before surgery usually significantly helps to reduce many of the complications that can occur after surgery.
Yes, I would
including
imagine so.
things like the post-operative delirium.
Okay.
Take along with you a family member or close friend who you can also have accompany you to the hospital or to the operating suite on the day of the operation and be with you after the surgery, perhaps in the recovery area, and possibly maybe even spend the night with you in the time immediately after the operation.
And I guess that would help with familiarity and help to decrease the risk of post-operative delirium because they're generally unfamiliar with this environment.
Agreed. So because the act of surgery and the provision of anesthesia and anesthetic agents themselves at times can be a bit disorienting, it is useful to have someone familiar around you to help create a bit of grounding.
Okay.
This can also be helped by maybe bringing one or two familiar objects from home that perhaps you use quite a lot, maybe your favorite teacup or a book that you like to read. And speaking of things that you'd like to read, you should also make sure that you bring along your glasses and hearing aids or any other kind of sensory aids that you use so that you'd be quickly able to get back to your normal functional state.
I hope this discussion will actually help elderly patients to go into surgical procedures or interventions having a much more positive mindset. Thank you all for your time and see you on the next episode of Senior Session.